last question for you, Dr. Nwobi, and again, we were very grateful for you to take time, between the clinics and the surgery center for you to take time and teach us these really valuable lessons. But for you
Yeah.
as a physician, when it comes to using a system like Gentem's or anything else, but since you're a Gentem user, I'll ask this. Your staff obviously uses it on a daily and weekly basis to really manage claims and reimbursements. But for you as a founder and a business owner, what's your favorite aspects or most valuable aspects of the software that you feel is something that physicians really need to start using?
Well, I just think of the dashboards and the trends that you can play with. Um, they really provide like a business dashboard for your practice in terms of your receivables. And you can see that in one snapshot. So you can get a bird's eye view of what's going on, and easily play with it. If there's some, and you can actually filter this, so you can filter the data as well based on the CPT code or certain patients. So it's easy to just pull up the data that you need. So that's one thing. In terms of the software, it's quite robust. Obviously, I don't get to the nitty gritty, but I'm able to at least get a good view of what's going on.
Got it. Got it. That makes a lot of sense. Well, Dr. Nwobi, thank you again for joining us and sharing this, and thank you to all attendees for the wonderful questions. Again, this webinar, is recorded, so we'll be sending out the on-demand version. Be sure to take us up on the offer. Aside from a demo, we do an analysis. When we speak to you, and we give you a lot of great feedback. Whether or not you decide to use Gentem is not important. We just are on a mission to really try help as many private medical practices stay independent and thrive. So be sure to sign up for our email newsletter for upcoming webinars. And be sure, Dr. Nwobi, you're active, I believe, on LinkedIn, correct?
Yes.
Great. Be sure to connect with Dr. Nwobi, and we'll be sending this webinar out in a few days. Thank you all for joining, and have a wonderful week.
Thanks.